If you get seriously sick in America, your first question usually is not, where's the best doctor or what's the best hospital? Like, where should I go? Oftentimes, the first question that people ask themselves is, can I afford this? Can I afford to go to the ER? Do I absolutely have to? Is it necessary? What if I just stayed home for a couple more days? I'm speaking from experience here. Even just in the last couple weeks, I had a situation where chest pain didn't feel good. I could have toughed it out, but instead I was like, well, I'm going to go to the doctor. And as I'm sitting in the waiting room the whole time, I'm thinking, well, how much is this going to cost me? What's the damage going to look like? And fortunately, I'm in a position where even if I do get a hefty bill, I can afford it. My family can afford it. My wife and I, we do well for ourselves. But that's not the case for everybody. And this system, this design, this is not an accident. This is how it's intended to operate. This is how the for profit medical marketplace is intended to operate. And so today, I want to walk through our second pillar of our platform. It's all about healthcare. It's not about slogans. It's not about vibes. It's actual structure, real structure that replaces our current profit first medical marketplace with something that actually behaves like a public health system. But first, introductions. Again, my name is Rocky Pedden. I am the host of A Renewed Republic. Thank you for joining me today. I'm excited to get into this topic. It's a big one. We're not going to be able to cover everything in a single episode. However, we're going to start laying the groundwork, but we will revisit healthcare many times into the future. If you like this content, please considering hitting the subscribe button, hitting the like button. But most importantly, as I always say, share this with your friends and family. It is drastically important right now that we have these conversations with those people who we love, who we trust, and start getting the ball rolling on what change we can affect in our political system into the future. Okay, so in our first pillar, we talked about soil and we talked about how the health of the land shows up in the health of the people. And this is true. We know this. If you are raising cattle or animals or agriculture, growing vegetables, whatever the case may be, when you deploy regenerative practices, you can impact the quality of the food that you're growing and thereby the health of the people who are eating it. But here's a very blunt reality that we face today. We spend far more per person on healthcare than any other wealthy country in the world. We spend the most. And what's even worse is that our outcomes are oftentimes worse than those other countries. People with insurance still avoid care. I'm a perfect example of this because they're terrified of what the bill is going to look like. Co-pays, not just your premiums, but like your total out-of-pocket expenses. It's insane. And we also have a situation right now where rural hospitals are shutting down. Mental health is treated like a side quest. It's almost impossible to find mental health services. Maternal mortality is going in the wrong direction. It's increasing, especially in certain parts of the country that are identifying as pro-life. And so, no, I have to say the system itself is not broken. It's working extremely well for the people it was built to enrich. And that's, I think, the first thing that we need to understand here. And when we think about what is the purpose of government, what is the purpose of having an energetic government? The purpose, at least in part, is to do what's best for the people of that nation. When we think about the general welfare, right now, today, do we have a system for the general welfare of the American people? The answer is very clearly no, we do not. We have a system that falls in line with everything else that is run in a capitalistic way in this country. And that is that we sacrifice, the vast majority of Americans sacrifice so that a small group of people become fabulously wealthy. That is true in your typical business environment, and it is true in healthcare because healthcare is a lot of those companies are publicly traded companies, and they have a primary responsibility to their shareholders. They have a fiduciary duty to make them money. And in healthcare, making money oftentimes goes hand in hand with denying care, reducing care, making it care more expensive, et cetera, et cetera. Okay. So the question becomes, What do we stand for? And for me, it's very simple: care over profit, prevention over crisis. If I were to have a slogan, that would be what it is. The health of the American people is far more important to me. The profits of companies like Cigna and Aetna and United Healthcare and Blue Cross Blue Shield and all the other groups and companies and businesses that stand between the people of a country and access to doctors, nurses, PAs, radio techs, or radiation techs, whatever the case may be. So, health to me is a public good. Essential care should be a basic right of living here. I mean, even visiting here. And it's not a perk of a particular job or a prize for having the right insurance card. And even if you think about how much stagnation there is in our economy because people are scared to leave their job out of fear of losing their health insurance. How many inventors and entrepreneurs have said, like, I'm not going to go and jump into my dream because I can't afford healthcare or health insurance on the open market for my family? That happens. It happens all the time. Every single day, people are making that decision, that determination, because they can't risk putting their children in a place or their wife in a place where if something were to happen, they would have a $50,000 hospital bill that would bankrupt them. The second point here is we have to have care before profit. Nobody should get rich by denying treatment, like full stop. And when the executive at United Healthcare was executed in the streets, the reason why there wasn't a public outcry is because that person was responsible for policies that enriched people, shareholders even of that company by having policies that denied care for the users of their programs. So we cannot have, if we're going to have a healthcare system, the goal of the healthcare system needs to be care. It can't be profit. Anytime the primary goal of a system is profit, you're going to look to not only build efficiencies, which can be good, but you're also going to look on where can you cut corners? Where can you reduce service? That is another form of efficiency that doesn't benefit the end user. We need to be thinking about how do we maximize the benefit for the end user. Third, we need to be prevention first. The cheapest and most humane healthcare system is the one that keeps people healthy to begin with, instead of only reacting when people, fall into an emergency, something ruptures, it fails, or when something spreads, right? Someone stays home because they think it's just a cold, but hey, oh, actually, it's a nasty, nasty virus. And all of a sudden, your immediate community and whoever they've come in contact with are potentially infected with whatever it is that they had. So when we think about prevention, it's not just about things like your food, but also thinking about getting in for your annual exam. When was the last time, ask yourself, that you actually went in and had an annual exam? You did your blood work, did a full workup, had the doctor check, all your vitals, all the good stuff. Had an EKG. Look, we need to be thinking prevention first. We already talked about soil, the food, and environment. Those are all healthcare inputs. So what we eat, the quality of the soil that we have, the water in our taps, the air that we breathe, those are not necessarily side issue. All these things are playing together. They are upstream health infrastructure. Point five, we need simplicity and dignity. One card, one system, no guessing game about networks, no surprise bills, no 2 inches of fine print, none of that stuff. When my dad was recently in the hospital for surgery, and my mom had the foresight to ask, hey, is the anesthesiologist in network? Answer was yes. Okay, great. The day of the surgery, the planned anesthesiologist is sick. There's a new anesthesiologist. My mom asked the question again. Hey, is this new anesthesiologist? Are they in network? Answer was no, they weren't. Mom's like, we can't use them. Find somebody else. And like, to their credit, they did. But had they not done that, my mom not had that foresight, my dad would have been stuck with a massive bill for that anesthesiologist for being out of network. That is supremely ridiculous. We should not be thinking about those things when you're preparing for a massive surgery. It's ridiculous. And lastly, accountability. Look, I'm not advocating that we should just dump a ton of money into a healthcare system. It's not what I'm saying. It is public money. It's being funded through taxes. We need to measure it. We need to have goals and expectations. We need to be looking at life expectancy. We need to be looking at preventative care, preventative hospitalizations if necessary. We need to be looking at mental health outcomes. Like, we need to think about the crisis that we're seeing in terms of homelessness and the correlation to homelessness and mental health issues, and finding ways to pull people off the streets, get them healthy, and get them back into the workforce. That's what this economy needs. That's what our country needs. Helping people help themselves is absolutely necessary. It's a big part of what I think a country needs to be geared around and making sure that we're really focusing on. And then we need to look at rural access to health systems. This cannot just be predicated all on making money. And that's what it is today. So when we see hospitals in rural areas closing, access to healthcare for rural communities is disappearing. That is a bad thing. And we've already talked about the soil. We've talked about the importance of farmers and ranchers. It's also important that we take care of those people and that they have access to healthcare. If we don't, we run the risk of those people saying, you know what, F this, I'm out, and leaving and moving into the city, or probably not moving into the city necessarily, but moving into a larger town where they will have access to those healthcare services. So at the core, we need a public guarantee. And this is what this platform is actually proposing that I'm talking about. So we build a universal public coverage system at its core that covers all medically necessary care, primary care, emergencies, hospital stays, maternity care, mental health, vision, dental, basic medications. That's going to cover the vast majority of what happens. In Oregon, we have an urgent care system called Zoom Care. It's freaking fantastic. To give an example, I woke up one morning, I was about to leave for a trip. I woke up one morning, I had a sore throat. And I was like, oh man, it's like 7 o'clock. I'm in bed. I pop on my phone, I pull up Zoom Care, I log into the app, I book an appointment for 9 a.m. that day. And when you pull up your Zoom Care, there's 15 Zoom Cares probably within, I don't know, a 30-minute drive of me. So like, and there's some that are really close and some that are further away. These are urgent care centers. They're staffed with PAs. They have like kind of like your most common medications on hand and antibiotics. So if you need it, typically they have it. You don't have to go to another pharmacy to fill a prescription. So, anyways, I book my appointment. I go into Zoom Care. I get there. I tell them like, "Hey, I have a history of strep. I'm a little worried this is strep. I have a trip. I'm leaving tomorrow. Like, I just want to run a test." And the PA looks at me. She's like, "Yeah, I don't think you have strep, but sure, if you want to run a test, we can run a test." They run a test. Sure enough, I have strep. She's like, "Yeah, you must have just caught this really, really early." They have antibiotics there. They have them filled. I pay my copay. It was like 25 bucks. I'm in, I'm out. I'm back home by 9:30 with antibiotics. That is an incredible system. Now, granted, not everybody is going to be able to participate in that system right now as it stands today. However, what we should be looking at is how do we have a Zoom care like system across the whole country? So many urgent care centers located within a certain distance of the population. There's so many Zoom cares per, you know, 100,000 residents, and they're within certain distances to those population centers. There's an algorithm there that we can figure out. In those Zoom care centers, they cover, I would say 92 to 95% of probably what most people need most of the time. So we supplement those urgent care centers, and Zoom Care has this system too, where they have like it's not an emergency room, but it's somewhere between emergency and urgent care. And it has more resources. Super Zooms, I think is what they're referred to. And in Super Zooms, they actually have doctors on staff. They can do blood work in those facilities. They have X-ray machines and CT scanners and MRIs, I believe, on premise in those areas, but it's at a quarter of the cost of what you would expect to pay at an emergency room, for example. And so, again, like more recently when I had that chest pain, they actually ended up sending me to a super Zoom care. And, there's not as many of them. They're not as prevalent. So I had to drive, I think I had to drive like 15 minutes to get to it. Get in there. I stay there for maybe 3 hours. They do a bunch of blood work. They do other tests. And again, they get me the medication, they prescribe it, they have it on premise. I don't have to go to another pharmacy. I'm feeling pretty crappy. I'm able to just drive home and get rest. And like that is what we need. We need these levels of care that people can engage with based on where they're at. But what this helps us avoid is like I went to the regular Zoom care first and I was triaged to a higher level of Zoom care instead of me just waiting, 3 or 4 days, nothing getting better, actually just getting worse, maybe developing like something like pneumonia or something. And then I have to go to an emergency room. And now we're really draining the resources of the system. And so if we had these other places where people could get like more preventative care type, or not necessarily preventative care, but when they first are starting to feel just a little bit off, they can go to these places, get checked up, and attack it before it becomes a major issue. That's going to have massive repercussions into the system in a positive way in terms of resource allocation. And then, if we could also develop a system within that Zoom Care network where they have preventative services, and I think actually that's something Zoom Care has recently come out with. I haven't used it yet personally, but like that's really what we need. And so at that point of care, we shouldn't be thinking about deductibles. We shouldn't be thinking about out-of-pocket expenses. Like if we want to have an out-of-pocket expense of like 20 bucks that people pay to get care, great. But if you can't afford it, can't afford it. Okay. Not the end of the world. We're not going to deny you care because you can't afford a $20 copay. In private insurance, like we don't have to get rid of all private insurance. It would just need to be something that is additive on top. It would need to provide a ton of value for people to actually buy private insurance. Um, but right now, like private insurance is sitting in the middle, sits between the doctors and the people who provide care and the people who need care, and it acts as a toll booth. I mean, there is no benefit that those companies provide to you as a consumer or frankly to doctors. And I actually have my son has a good friend of his whose dad actually oversees a pediatric emergency room here in Portland. And I asked him one day, we were doing a vacation together with our kids. And I asked him, I was like, hey, what do you spend the most amount of time in your day? Like, what does it go to as a doctor? I'm just genuinely curious. And his answer shocked me. It was the majority of my time goes to, and maybe not the majority, but the biggest slice of pie of my time goes to responding to coders. And I was like, wait, what do you mean responding to coders? He's like, yeah, we have the most common job in a hospital are coders. And one of the most common jobs at insurance companies is also coders. And coding is how they get to like whatever the value is of the care you're receiving. It's through all these codes. And the codes are set up, I believe, by the AMA, the American Medical Association. And he was saying that insurance companies obviously want to minimize the dollar value of care being delivered to people. And so if they see a code come in that's really expensive, they're going to have their coders review that case and see if that case should be, quote unquote, recoded to something else. And similarly, hospitals in some cases are looking at codes and being like, well, can we get more money out of people if we code this in a particular way? This has also happened to me and my family in a really bad way where we got coded incorrectly and it ended up turning into like an $8,000 hospital bill. And it's something that we are still fighting today. And so when you have these private insurance companies in the middle, they're going to do all the things that companies do. And some of those things are good. Building efficiency in the system, that can be really beneficial and positive. And we should work to have a public system that seeks to bonus people off of building efficiency. Like that's how you can incentivize that behavior. But what it also does when you have the privatized system is that it finds ways to, like I said earlier, cut corners and reduce the level of care that people are getting or what they need, or it's calling their attention to something they shouldn't be focused on when they're going through a medical emergency, or their kid is going through a medical emergency, or their parent or their sister or whoever in their family or friend group is going through that. So, like, look, essential care is a public promise. It's not a private product. That is what we need to be moving towards. And when we look at the government shutdown that we just had in 2025 for whatever it was, 43 days or 45 days, look, we have to think about like what was on the table, like what were the Democrats holding fast to, as well as to the fact that millions of people are going to see their healthcare premiums double, triple, quadruple. Unacceptable. Under a public healthcare system, we don't have that problem. And look, Republicans are going to come out and they're going to say, we can't do this for a number of reasons. They're going to say socialism. Most of them probably can't define what socialism is. We have tons of social programs that are wildly popular. Social Security, for example, has kept millions, tens of millions of people out of poverty. Like, it's been a wildly successful program. Granted, it's been managed poorly by Democrats and Republicans. They've both borrowed from the fund. There's a lot of issues with Social Security, but make no mistake that it has been a wildly successful program, as has Medicare, as has Medicaid. All of those programs have been very successful for the most part. Now, is there waste in those programs? Of course, there is. What percentage of waste are we comfortable with as a country? And if people say, I'm not comfortable with any waste, I just think that's a ridiculous answer. But if someone comes to me and says, yeah, our systems are running between 92 and 96% efficient, I am really happy with that personally as a taxpayer. That is a good use of my money. It's a lot better use of my money than dropping bombs in the Middle East on people who I don't know, like, who they are. It's a lot better than the use of my money of going to build other countries' infrastructure and medical systems. I'm thinking of how much money we send to Israel, for example, and how that money is used and deployed across their communities. And so, I, look, that's one thing that Republicans will come out and say. The other thing they'll come out and say is this will increase your taxes. And you know what? They're right. It will most likely increase taxes. But that's going to increase the taxes for the people who are exceedingly wealthy. Because right now we have a tax structure and a tax system that is vastly underperforming where it should be. And if we want to talk about making America great again, one of the first things we should look at is like, well, what was the tax code during these great American decades? What did that look like? Newsflash, it's a lot different than what it looks like today. That's another video we'll get into. Um, but the fact of the matter remains is that your taxes might go up a little bit. However, your total out of pocket expenses for healthcare will go way down. Because right now, if we look at, like, my health insurance for my family is like $700 a month in premiums. That is insane. I'm paying $700 a month to have access to healthcare, and it's a high deductible plan. And so my total out of pocket expenses just for my portion can be, I believe that the max out of pocket is 15K plus $700 per month. So that's another, what, 1,400 or 7,000 plus 14. It's another $8,400 on top of that. So my total out of pocket potential in a given year is north of $22,000. That's just not acceptable. It's not acceptable. And so Republicans will try to scare us out of this system. They'll try to say, oh, the system right now that we have today is the best healthcare system in the world. That's bunk. That is not true. There are plenty of great healthcare systems out there that do a wonderful job of taking care of their people, giving them all the options in the world in terms of who they get to receive their care from without bankrupting them. We are approaching 1 million Americans who go bankrupt every single year from healthcare bills. That should not happen. So how do we pay for it? Um, Look, like I was just saying, it's not free. Nothing serious is free. So this is what we're trading when we think about the cost. We're getting rid of premiums. We're getting rid of deductibles. We're getting rid of surprise bills. And we're getting rid of those medical bankruptcies, right? Like almost 1 million people a year going bankrupt from medical debt every single year. No more of that. And so when we talk about taxes, it's a progressive payroll contribution that replaces employer premiums. Higher earners and large capital gains, they have to pay more too. Real savings can come from cutting waste and reducing administrative overhead. So when you think about those companies that stand between the people and care, the Aetnas, the Cignas, the Blue Cross, Blue Shields, they are all for-profit companies. So at a minimum, they are probably driving a 20% net profit margin. So you have all these extra people in administration, the CEOs, the executives, marketing budgets, all of those things we pay for indirectly through premiums, through price hikes, through administrative fees, all of that stuff we pay for. Now, we may not pay for it directly with a tax, but we pay for it through our all those things I just listed. And so when we remove them from the equation, yes, we will still have to have, like, imagine like the employees of those companies doing the work in the administration side, for example. We will still need some of those people, but we will find a ton of efficiency, not only by deploying AI in those cases, but also by getting rid of all the extra overhead and just the net margin, because we don't need to be operating our healthcare system at a profit. That is not the intention. The need of government is not to be running the government at a profit. That is not the point for these systems. Now, granted, right now we do need to run the government at a little bit of a profit, or as much of a profit as we can squeeze out of it without reducing services, because we are in massive debt. But realistically, if we had been doing this all along the right way, instead of just running up the credit card bill year after year after year, then we wouldn't be in that situation. Over time, too, if we move to a preventative healthcare system over 10, 15, 20 years, we will see the impact of better health outcomes. If we can work with people to have better diets through our first pillar of soil and better food, and then also getting into doctors earlier before there is an issue, then we will have better health outcomes in the long run. So the goal for me becomes really clear. Total national health spending flattens instead of racing upwards, which is what's happening today. The average family's net cost for healthcare, including premiums and out of pocket bills, go down. Granted, taxes might go up, but your total out of pocket that you spend towards healthcare expenses go down. Not should, it will for most Americans. Now, the wealthiest Americans, their taxes are going to go up. They're going to pay more because, frankly, that's what's necessary in society. And if we want to have that argument about not taxing billionaires more, I am happy to have that argument, because we've been trying to make trickle down economics work for the last 60 years. And newsflash, it has never worked, ever. So stop playing that card. It is tired. It needs to be retired. Okay, so cost control, plugging all these holes. If all we did was give universal coverage with no cost controls, we would just be pouring tons of water into a leaky bucket. So we have to change, if we think about that same analogy, we have to change the bucket. So here's a few big levers. First is drug price negotiation. We pay more in drug pricing than I believe any other country in the world. Like Bernie Sanders, for example, ran campaigns to bring drugs from Canada to his constituents in Vermont at like drastically reduced prices. We know that other countries do a much better job of drug negotiation. And granted, like President Trump just negotiated GLP-1 prices. In a perfect world, we don't need GLP-1s because we are eating better diets. There's a lot more information that's readily available today how to have a better diet. We make that food more affordable, and we really focus on producing healthy food for our constituents and for our people. We also pair that with a more robust preventative care health system. We also need to look at hospital budgets. Hospitals get funded based on the communities they serve and the outcomes they deliver, not how many billable line items they can squeeze into a stay. When we think about access, especially for rural communities, in that model, every community needs to have a Zoom care. It needs to have an urgent care center where people can go and get treatment. If there's another doctor's office there, that's great too. It's always good to have those services available. But we also need to think about hospital services. And that means that there needs to be a way for farmers and ranchers in rural communities to be able to access hospitals. And I'm not necessarily saying that every community has to have its own hospital. It could be a situation where those communities have access to hospitals via air transport, like helicopters, within certain radiuses, and so there needs to be hospitals strategically placed throughout the country where we can reach the rural communities in a timely fashion if there is an emergency that needs to be triaged at a hospital itself. We just talked about administration simplification. So, again, though, like we need to have one set of standards here. I don't know how familiar you all are with like different charting systems. Um, and I'm drawing a blank on what they're called. Practice management solutions, maybe. Anyways, I know examples of them, like Athena Health has a system. It's an EHR system, electronic health record system. We need to simplify this into one system. And this is a lot easier said than done, I realize. But we need to make this project happen. We need to pick one and we need to make it a government led system. And I don't care if we use Epic, I don't care if we use Athena Health. I really don't care which one we go with, but we have to do it. There needs to be one rule book. We can cut massive overhead from all the coders. Like we don't need those coders anymore, at least not nearly as many of them. Um, and just in general, of every insurance carrier having its own rules, its own codes, and its own paperwork that's unique to them. We get rid of all of that. We simplify the system into one shared system. Then we also have the executive pay discipline. This is government funded. Then there's no longer CEOs who are getting, $25 million on target earning packages on an annual basis. Like that adds up. Once you start looking at not just CEOs, but CTOs, CFOs, COOs, the entire executive suite for multiple tens of companies. I mean, it ends up probably approaching $1 billion a year spread across the every citizen. It's not a huge amount of money, but again, it's going to reduce the costs that we all pay into having a preventative healthcare system. And then we just make everything super transparent. What are reimbursement rates? Contracts for everything are public. If you're billing the public gets to see the bill. It's that simple. And we have watchdogs who are looking after that. We deploy people, we bonus them based off finding waste inside these systems. Like there are ways to build incentivization structure, not just in healthcare, but in other government programs where we can really eliminate fraud, waste, and abuse. And look, I love the idea of what Doge was. I love the idea. It was executed horribly. It was a flawed program from the beginning. And who knows what data Elon Musk got access to. I think that is another topic for conversation, but I think that's really scary. But anyways, let's move on. The front door, and I'm just going to reiterate on this, is community urgent care centers. It's a Zoom care model. They handle the everyday stuff. Yes, in the neighborhood, it's close to you, it's easy to get to. It manages the vast, vast majority of the things that each of us need when we get sick. And then we get triaged to bigger and bigger facilities or more complex facilities as necessary. Or if we have chronic disease, we can go straight to those specialists. If we have cancer, we go to the cancer specialists. I realize me saying it's that simple, an oversimplification, but there is a way to build this system that really benefits the everyday person. And again, if we have these urgent care centers spread out throughout the community, I have never been in a Zoom care where there are more than two other people in there at a time. They have a really tight scheduling system and they stick to it. And I've gone to them a bunch with me, my wife, our kids. I've never had to wait for more than like 5 minutes past my appointment time. When was the last time you went to a doctor's office and you got in to see the doctor in a timely fashion? I mean, never for me. And so, like, the whole idea is we can triage more effectively. We can eliminate like sick people being around other people who maybe aren't as sick, but who are in the emergency room because they have no other option. It's going to really build a ton more efficiency. We can also build these inside public spaces that already exist. So think like even like library spaces, school spaces, anything where there is already public infrastructure in place, we can add these clinics. Like they do not take up a ton of space. And if we have a bunch of them and it gives people the optionality in terms of where they're going to receive their care, you don't need to have a ton of space at each of them, so long as you have enough of them to service the population. And again, I'll just double tap. I'm just going through my notes here, but like prevention is important. Prevention is key. And part of prevention is the food we're putting into our body. Part of the prevention is building the soil back so that we have a place to grow healthy food and raise healthy food in a humane way. But prevention is also just having access when you start feeling sick and not having to ask the question, can I afford this? Can I afford this treatment? Can I afford going to the doctor? That should never cross our minds. It might have to choose between paying for my kid being able to go see a specialist and the heating bill this month. No. So let's talk really briefly about mental health and addiction. Um, we can't pretend that a health platform is a serious health platform if it doesn't address mental health and addiction. We can't think of those things as afterthoughts. And we can't think of, vision and dentistry as afterthoughts either. All these things need to be included. So, mental health coverage is treated exactly like physical health. Same networks, same priority, no extra hoops, right? It's easy to find psychiatrists, psychologists. It's easy to talk to those people. Those people have the ability to triage in terms of the needs of their patients. So, if they need a more in depth, like if a psychologist says this person needs to speak to a psychiatrist, they get access to a psychiatrist, and we can start building these community centers with these professionals. Community mental health has to be built into the system. Walk-in counseling, crisis support, group therapy, it's all baked in. Especially as we're moving into AI. And like, don't make no mistake, we are here. AI is here to stay. It's not going anywhere. I keep on seeing people talking about, well, you're not going to lose your job to AI. You're going to lose your job to someone who knows how to use AI better than you. That is a bunch of bullshit. Look, jobs are going to be destroyed. And there are some people who are predicting that unemployment is going to not just hit like 20, 30, 40%, it's going to hit like 70, 80, 90%. And if we have that situation and we don't have a way or an outlet for young men in particular, we are going to have a massive crisis on our hands in terms of suicide. And also, I would predict that will go hand in hand with other violent acts and mass terrorist, like domestic terrorist acts. um, Addiction will go up. And we need to have a solution in place, and we will talk about how we build purpose in life without a job, because like that future is coming. And a lot of people don't want to address that or look at that and say like, yeah, this is worrisome, but it's coming. And at a minimum, unemployment of 30%, without a doubt in my mind, we will be there within 5 years, if not sooner. We're going to see massive unemployment. And so, having a healthcare system that can help with addiction is going to be massively important. If you think homelessness is bad now, if you think addiction and drug abuse is bad now, wait until that happens. It's only going to get way, way, way worse. And we need to open up addiction treatment. In my mind, like we have all these drugs and compounds labeled as Schedule One drugs, like DMT and I think ketamine. And I'm not sure where ketamine is labeled anymore, but all of these drugs, psychoactive drugs that have shown to provide a ton of benefit in being able to treat mental health. Psychedelics are shown to be really beneficial in the treatment of mental health and also in terms of finding purpose. And so we need more of those treatment centers. We need more community. And this is all going to connect directly to our criminal justice system and reform as well, which we're going to talk about in greater depth. Okay. Um, Again, I'm looking at my notes here. We can't leave out rural communities. We've talked about that. We can't leave out underserved communities. This has to apply to everybody. Access needs to be for everybody. And when I say access, I'm not meaning like, hey, like today, I technically have access to buy $100 million house. No, I can't afford $100 million house, but I have access to it. It can't be access like that. It needs to be access like I can walk into a community center and I can get treatment that day, or I can call and make an appointment, or I can go on my phone and make an appointment, go on my computer and make an appointment and get treatment that day or the next day. And that needs to be true for mental health situations, it needs to be true for addiction, it needs to be true for a cold, all of those things. Another way that, like, another, and I know I said I wasn't going to use slogans, but another slogan, if you will, is dignity across a lifetime. So, two things kind of come to mind for me for that. First, reproductive and maternal care. So, look, I understand people don't like abortion. And look, if you're a Christian and you don't agree with abortion, I would love to have a conversation with you because I just don't know where that's coming from. I'm reading a great book right now called The Separation of Church and Hate. And it's really interesting how he breaks down the scripture. Um, so I would love to understand that better. I think at a minimum, though, when we think about abortion, that everybody can get on board with is how do we reduce unwanted pregnancy? Because if we can reduce unwanted pregnancy, we will by default reduce abortions too. Also, like we need to understand, like why are people having abortions? And I would venture to guess that most of the time people have abortions, it's probably an economic decision. There's some level of economics where like I can't raise this baby, whether that's like in a solo parenting situation or like they just don't have safe and secure jobs. Like there's a lot of reasons that could be the case. Economics could be the reason. Um, but when you make legal abortion and contraception as part of national health, it's just a guarantee. And that decision needs to be made between a woman and her doctor. Like full stop. That's just what it boils down to. Um, we need to standardize and improve prenatal care. High pregnancy risk management is another thing. Postpartum mental health, we need to have full support for that. In Amsterdam, in the Netherlands, we have family there. And if I'm not mistaken, when a woman delivers and they go home, there's actually a program that the state sponsors where they actually send like a maid to your house a couple times a week for the first couple weeks where they come, they help prepare food, they do laundry, they just help you around the home. You also, in a lot of those countries in Europe, you get between 6 and 12 months of maternity leave. There's also a lot of paternity leave, which is great. I mean, when all three of my kids have been born, I have not taken more than like 2 weeks off. It's just like that's just not the way it is in the United States, and that needs to change. And look, again, we need to think about collectively as a group, what is the purpose of the United States? What's the purpose of life? Is the purpose of life to go to work to make a small group of people fabulously wealthy? If that's the purpose that we all agree to, well, first of all, I'm out. I'm going somewhere else. But second of all, like, why? Like, that doesn't, like, no one is going to agree to that. The only people who want that to be the purpose are the people who are getting fabulously wealthy. And for the life of me, I can't understand why they want to get so fabulously wealthy. What can you do with $10 billion that you can't do with $1 billion? I can't answer that question. I just can't. It's unfathomable to me to have that much money and not just be solving problems left, right, and center. We also need to understand and close racial gaps. When you look at maternity health in particular between Black women and white women, doesn't look good. It looks very, very bad. It's like when people say systemic racism is a thing, look at those numbers and tell me that it's not a thing. It's very stark. It's very obvious. We also need to be talking about long-term care and disability. So we want to prioritize home and community-based care. People can stay in their homes and communities when possible. And that includes people at the end of their lives. We want people to be able to die with dignity. We want to be able to have those people surrounded with their family members, not having to worry about debt or bills, in the comfort of their own homes if they so choose, with a healthcare professional by their side administering pain medication or whatever the case may be. Um, yeah, we also think about we can expand this into disabled people. They're not forced into poverty or institutionalization. Just to qualify for basic services, which happens a lot today. And we also need to look at nursing homes and assisted living facilities. Like those are held to really clear and quality standards. Like when you look at this, those communities, the difference in quality in those communities is it's insane. And it's tied directly to how much money people have to be able to pay for those services. And some of those are $20,000 a month. And you can imagine the difference. Um, so we need to standardize those situations as well. Okay, as we're kind of getting to the end here, there's a couple more sections that I want to go over. I know this video is long, and like I said, healthcare is a beast. There's a lot that goes into it. It makes up a huge part of our budget. So let's talk about the politics. Um, this plan has losers, and we need to be honest about that. So those for-profit insurers, they're going to lose a very lucrative business model. That means jobs too. And that's not lost on me. And some of those jobs will be picked up by the federal government. And look, there's going to be people who say, like, oh, we can't have the federal government getting bigger, more federal employees is a bad thing, blah, 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 blah. Look, this is what I'll say. After the Great Depression, when FDR really started hiring and going after injecting tons of money into the US economy to pull us out of the depression. He did that by creating government jobs, millions of them. And that ultimately, that activity paired with World War II pulled us out of that Great Depression. Having a bunch of government workers, so long as they're doing good work and they're efficient and they're providing the services, that is not necessarily a bad thing. Now, should it be managed appropriately? Of course. Of course, it should be. There should be tension between the government and the people. The people should be making sure that the government is being efficient with our money. But at the same time, we need to make sure that we're providing services that all people need. And we can't be cutting people short so that the government saves money. There is a fine line there. There's a balance. And I use the word tension intentionally because I think tension is absolutely necessary. Now, if I'm talking about all these policies, things that are really important to me, and let's like just go down a rabbit hole. And if I became president and like that tension would still need to exist, I would expect you and all Americans to hold me accountable for the things that I'm talking about today. And that tension, because like the fact of the matter is we know power corrupts. It does. It corrupts most people. And everybody would like to think and say, like, oh, well, it wouldn't corrupt me. But we see it time and time again with politicians. It happens over and over and over again. And so that's why we need to have systems of transparency, government oversight, and watchdogs. We need to incentivize people to hold those other people accountable who are in power. So there's going to be, hospital executives, maybe not hospitals as much, but the insurers, like those guys are gone. We're going to be putting caps on compensation for hospital administrators. Segments of big pharma will certainly fight hard to keep pricing power. And this is going to be a big fight against the pharmaceutical companies in particular. Because the fact of the matter is, a lot of the pharmaceutical research is funded with US tax dollars, but then the US taxpayer does not get the benefit. They still pay more for those drugs than other countries do, even though their tax dollars subsidized a lot of the research that went into drug development. That is backwards. I don't care if you're a Republican or a Democrat, an independent. That is not a fair system. There's also going to be certain unions who are not going to be happy about this. They might worry about losing bargaining chips. So this is how we phase it. In the first couple of years, we can expand public coverage to children and older adults. So we essentially think of Medicare for all, but it's not for all yet. It's just like layering in groups. And we start rolling this out across community centers. We can start looking at like how we build the network of urgent care centers, and we start doing that. In the next phase, over the next 7 years after that, we bring the rest of the population into the national plan. And while shifting what employers currently pay in premiums into a just simpler payroll contribution, we simplify that aspect of it. And I will tell you, I have the experience, I run a small company. I have the experience of both being just a user of healthcare, but also of the person responsible for finding healthcare plans as a business owner for my employees. And I'll tell you, it freaking sucks. It is the worst part of the year every year, having to go through that process, working with various carriers and insurers and all this other garbage. It is a massive waste of my time every year. And I have yet to meet a business owner who doesn't agree with me wholeheartedly on that. And all throughout this, we provide retraining, we provide job transitions, we provide, um, everything that we can to make this transition as smooth as possible. There was, I believe, a Harvard study that showed that if we switch to a single payer system, like a Medicare for all system, and we just gave everybody who we had to lay off like a 2 year severance package, that would still be cheaper than maintaining our status quo. Yep. That's how out of whack our healthcare system is right now. So, how do we measure success? If we don't have a scoreboard, this thing's going to collapse into a political fog. I mean, that's what will happen. So, we have to have metrics that we're tracking: life expectancy overall, and by region and by race, preventable hospitalizations for chronic disease over time, Out of pocket costs as a share of income, administrative spending as a share of total health spending. Again, these things are all happening over time, and we want certain things. We should be making assumptions about where they should land. Our cost should be in the ballpark right now of between, I would say, $6,000 and $9,000 per person in terms of healthcare expense. And if you compare that to today, we pay, I believe, north of $16,000 per person. So we're paying more than double a lot of advanced countries, other Western civilizations and cultures pay in their healthcare system. There are some that pay more, not more than that. The United States pays the most, but there are some like Switzerland, I think, has a high cost per person, but their healthcare is like bulletproof. It's nuts. If you go look at it, it is absolutely bonkers what they get. You would have a comparable plane in the United States, your premium per person would be somewhere in the order of like $500 or more per month just to have access to that. Okay. We have mental health outcomes and suicide rates, tracking all of that. Um, Access metrics for rural and underserved communities as well. And all of this needs to be public, forward facing, tableau reports, however you want to do it. I don't really care. It just needs to be available for everybody. All right. Let me bring it all the way back. This pillar is not about big government healthcare versus private sector innovation. That is an old script. Republicans will try to tell you, like, our healthcare system will break down if we do this. No, it won't. This is about three basic commitments to everyday Americans, to working class Americans. Everyone gets in the door when they're sick. Nobody goes broke for staying alive. We stop paying twice as much or three times as much or four times as much as other wealthy countries do for worse results. If we want a functioning republic and democracy, we cannot treat sickness as a profit center, pure and simple. We have to treat health like shared infrastructure, the same way we treat roads, clean water, electricity, clean air, etc. If this vision makes sense to you, here's what I would ask. Share this video with someone who is sick of the current system, but skeptical that change is possible. Share it with people who have bad experiences in healthcare systems. I know I have. I know friends. I know family. I have to imagine everybody knows somebody who's gone through a terrible experience because they had to go to the hospital. And maybe they got a sneaky bill from someone who was out of network. There's a lot of reasons. There's a lot of things that could cause that. Second, tell me in the comments what you would most want to see in a healthcare guarantee. Like, what would that look like? What's the most important thing to you? And then just make sure you're subscribed because we're bringing out more content like this and we're building this platform. And look, I don't want to make any bones about this anymore. I want to get involved in politics. I don't know how to do that yet. This is my way of getting involved and starting that process. But I want to move things like this forward for everyday Americans because I'm sick and tired of the crappy experience that I get. And frankly, like, I am in a privileged in a lot of ways. And one of them is that I'm fortunate that, again, my wife and I do well for ourselves when we have money that we can spend. And it breaks my heart every single time I'm in an office, a doctor's office, a Zoom care, I'm somewhere and I see people and I can see the anxiety on their face. And I can see that some of it is like they're worried about their kid or their spouse or themselves. And some of it is, I just get this feeling, and I don't know for sure, but knowing the numbers, I know some of it is economic in nature. They're worried about being able to take care of putting food on the table or paying rent. And God, man, I just tell you, it breaks my heart every single time. And if you have friends who are Christians, and I'm not overly religious myself, but I hear from the religious right, the Christian nationalists all the time that we can't afford these things. And look, I think the only argument against those people is like, what would Jesus do? Because I can guarantee you what Jesus would do. He would treat the sick. He would take care of them. He would pay for it. Like, he did this for free. So we don't need to get into a religious conversation today, but as a country to move forward, we have to have a single payer healthcare system that is not based in profit. We have to have a system that seeks to benefit the average American, the working class American, to make sure that they have not only access, but that access is actual real healthcare. No surprise bills, no bankruptcies, no anxiety, no stress. That's all for today. Again, thank you for your time. I know this is a long video. I hope it's useful. I hope you enjoyed the content. Please like, share, subscribe. Have a great day.